Senator Julie Rosen. It is Friday, February 18th, and we are back for the final meeting of this month of the Governor's Justice and Reinvestment Initiative meeting, and it's very good to see you all. My co-chair, Kevin Reese, has got a few technical difficulties. You want to give it another try? Chair Reese? That's why he's not going to be speaking anymore until we get that figured out. We do have testimony today going forward, and then I think we're going to open it up after that to a good, healthy discussion. I'm not sure what holds for us going forward, except the fact that we are putting together a bill for an investment in our delivery systems with a report back to the legislature that will probably get some time in front of the Judiciary Committee in the Senate next week, and hopefully in the House too. And then from that point, it'll come to finance, and we'll see how that goes. But it's a compelling argument, and one of the first priorities on this list that the counties need to be equitably funded. And so that's why that's my first priority as finance chair, to make sure that we get that up and going with, it'll be in the base, basically. 20 million is my hope. Unfortunately, members, I'm going to have to get off at 3:00. So I would like to just say it's been an honor to serve as the co-chair with Chair Reese and serve on this wonderful initiative. I want to thank you all for being a part of this. I did announce my retirement yesterday from the legislature. I got paired with another great senator, Senator Draheim, in redistricting, and so it made my election much easier. And we've had quite the last 24 hours. We just lost Congressman Hagedorn last night too. So a lot needs to be worked on today. But with that, I am going to turn it over to Grace. Thank you, Grace.
Grace?
Yes, Representative Moran.
And Senator Rosen, before you leave, I have a question. We were just talking about my retirement from the legislature. You're going to be missed too up at the Capitol. Just want to say that you're going to be missed. And for this process here, are you carrying the bill in the Senate, whatever we come through?
No,
okay.
Representative Moran, it is Senator Pratt.
Okay.
And it'll have to be amended in either judiciary or in my committee, finance. Yeah.
Okay.
Yep.
Any House authors?
I don't know, actually.
Okay.
But it is under Senator Pratt's name. Yeah.
Okay. All right.
So we will make sure you get that. Madeline or Marissa, could you make sure we circle back with her?
I'll find it right now who the House rep is, and I'll put it into the chat. And Representative Moran, I'll follow up with you when you're out late to make sure you have that language as well.
All right. Thank you.
Thank you, Representative Moran.
Thank you.
Thanks all around. Nice to be here with everyone today. We're flipping the script a little bit today and starting with the public testimony. What we did was send around a priority list of policy options that could make the biggest impact in the short term. From the update that we got from Senator Rosen, it sounds like that is definitely going to be an uphill battle for any of the policy options to be in legislation this year. But we are glad to have the resources and some of the tools that we need to just increase the support and supervision. And then what we have to do through this group is see where we have agreement or disagreement, and then carve out a path forward. So what I'd love to do is if we could start with the testimony. I'm actually going to start with our colleagues in Ramsey County who did the sound check first, and we'll let y'all introduce yourselves, and you have 3 minutes.
Thank you for having us. We are all providers in the Ramsey County Correctional Facility mental health team. We also do mental health care for any individual that is on adult probation at our juvenile detention center. This is just a small portion of our team. Would you like me to respond to the 3 questions that were sent also, Grace?
That sounds
So
great. Thank you.
we were sent 3 questions to respond to. Question number 1, behavioral health needs of people on supervision. And our group talked about providers that have flexibility and want to meet with justice-involved individuals, that have specialized training in how to work with justice-involved individuals. Services that are beyond or prior to severe and persistently mentally ill available services, as many people with long histories of incarceration do not have the mental health histories to qualify them for those types of services. Care coordination to get them set up with mental health, medical, and basic needs. So really applying a holistic approach that is mobile and can meet people where they're at. Services that work with all justice-involved person, even persons labeled or leveled, and with those with violent histories. Culturally specific services with wraparound care that are available regardless of health insurance. Mental illness and chemical dependency treatment programs that are mental health intensive for therapy and psychiatric interventions. More youth mental health and chemical dependency treatment programs. Youth inpatient programs, support for families when they have youth and a child in placement. Inpatient health services that take all insurances and people regardless of their offense history, and supportive housing with psychiatric and medication support that is also independent living. Question number 2, challenges and barriers. Health insurance does not turn on until prior to somebody leaving a jail or a county-run facility, which makes it difficult to set up those services. Being banned from care because of too many missed appointments, few appointments available outside of business hours, health insurance not covering treatment or mental health needs adequately, lack of access to technology for Wi-Fi or virtual visits, and housing supports for those that don't meet other levels of care. Question number 3, any ideas, thoughts, or models that would be useful? Offering payment for providers in the community to do outreach or to call and have soft contact or touch points with clients and that they can bill for that are no-shows. Care coordination that can be done through licensed providers so that person only needs to see one provider and doesn't have to have all of those services brokered out. Access to mental health care free of charge through probation. And support from county entities or smaller agencies to start offering services for our justice-involved individuals. And housing. I just feel like I should say that for the rest of this time. Housing support and also continuing to have housing support in some previous models we've had that also has medication support and mental health care right in the residence. Thank you very much for this time.
Thank you, Anna, and thank you, folks from Ramsey County. We appreciate your testimony. I'd like to go now to Commissioner
Grace?
Morrison. Yeah, sorry, go ahead, Senator Rosen.
Is there an opportunity to ask questions? Thank you. I'm just wondering, and Senator Marty and I just had this conversation. Are you familiar with the Yellow Line project?
Yes.
Yes, are you implementing something like that? Are you implementing something similar to that in your county?
The model we have in our county is one I haven't seen in other locations. We literally offer mental health care to any individual that is on supervision in Ramsey County with the hopes of triage, with the hopes of direct care, really to ensure that mental health is not a barrier. So some similarities to the Yellow Line project, but also some differences with that project implementation.
Mm-hmm. And do you know other counties in the surrounding area? Does everybody have their own model? Is there a sharing of information? How is this working with all of our other counties?
So I know we do have some sharing of information and how folks implement services. It also depends on where the funding source is from. For example, for our team, we are all corrections employees. So there are some different models that use public health services or mental health services throughout that county entity. So I think it all kind of differs. And yes, we do share some information as questions come up.
Mm-hmm. Just trying to figure out how to create that model for all the counties of some kind of model that fits them correctly, but to implement these types of measures.
I think that would be wonderful to make sure that we have access to care for all of those individuals across the state.
Mm-hmm.
Thanks, Senator. Yeah, Senator Marty.
Thank you. I have a question as well, and I'm really pleased to hear you say that you feel that everybody under supervision Ramsey County who needs mental health care are getting it. I think that should be something we have to prioritize statewide, but also SUD treatment. What's the situation there in Ramsey County?
Can you repeat that last portion? Did you say SUD, substance use?
SUD treatment for people who are under supervision who need it. How many are there? Some getting it, all getting it, whatever, because I'm hearing gaps around the state, and I'm glad to hear at least the mental health you've got everybody somehow or another. Yeah.
Well, I feel like we do a darn good job of trying to make services accessible. I think access to substance use care in particular with regards to MICD treatment is difficult. I think that we are having your question comes at a time where the state's in a lot of change with regards to Rule 25 assessments and comprehensive assessments. So I'm hoping that a lot will change with direct access becoming more applicable for all individuals, and hopefully that will increase access to care, choice in care, and also kind of taking out that middle person involved with SUD level of care.
One follow-up, if I can, Grace, on that thing. I was hearing though from some that the state's direct access, which I really like and support, was in many cases overriding the court supervision. And if a probation officer, they don't do collateral contacts with the person in the Rule 25. And if I need SUD treatment and I'm under supervision and you're supervising me, that now I can, with the direct access, we're at the point where I can just go ahead and say, oh, I don't want your stuff. I'll get my own assessment and I'll do it whatever level I feel I need. And I'm hearing from some supervisor folks that they're losing clout there. And I'm wondering if that is an issue with you or not.
I have not seen that specific issue. It would not surprise me if that would be present. I think there's going to be a lot of things to work through as direct access becomes more common. And I'd like to talk about this a little bit later in the thing here, not just with this testifier, but just real quickly, I do have concerns that the people who are under supervision, that direct access, I strongly support that, but I want to make sure that we're not overriding the court's jurisdiction on it too, because that could make it worse for people we do have the control of right now. And I don't want to have over control, but in a case where substance use, people don't always know the extent of their problem or they want to deny it. So anyway, thank you. That's enough thanks for the answers though.
Thanks, Senator Marty. All right, Commissioner Mortensen, thank you. And you have 3 minutes.
Thank you. Madam Chair, Chair Reese, members of the Governor's Council on Justice Reinvestment, the Council of State Government Justice Center, thank you for this opportunity to offer testimony in support of the recommendations of the Justice Reinvestment Initiative. Thank you for your vast and really vitally important work in this effort. By way of background, I am an Otter Tail County Commissioner. Before this, I was a prosecutor in the Otter Tail County Attorney's Office for approximately 30 years. And that offers a perspective of the criminal justice system, both as a stakeholder and prosecutor, but now also as a county official. In other words, 2 types of public service, each with their own rewards and challenges. First, a bit about Otter Tail County. Our county is in west central Minnesota. We are the 8th largest county in terms of area, but rank much lower in population. We are unique in the sense that we are too big geographically to be considered sort of small, and we're too small in population to be considered sort of big. For example, from one corner of our county to the other, diagonally, that spans over 70 miles. As much as the geographical size can be an attribute to our county, it also presents challenges in our delivery of probation services. We are a CPO county, and that's a delivery system that works well for us, but we are not without obstacles in the delivery of probation services. And that's where sustainable funding for supervision services is critical in providing both effective and equitable supervision throughout our entire county. We implement evidence-based practices with cognitive behavioral programming. We focus on developing life skills, self-efficacy, and perseverance, and that's to avoid reentry into the system. We recognize the importance of the relational approach to effective services, and we do all of this in the context of a large-sized county where agents encounter long driving distances to meet one-on-one with probationers, and those on probation or pretrial supervision face transportation challenges to make behavioral health appointments or even court appearances. Even options such as telehealth are not always possible with significant broadband voids throughout our county, requiring more person-to-person contact. All of what I'm saying supports the need for sustainable funding. Just to highlight this, in 2019, our county's levy budget for probation totaled over $2.2 million. We received approximately $138,000 in state reimbursement and also funding in the form of workload reduction grant to supplement the salaries of 3 positions. But this leaves the county with a substantial burden for the remainder of the probation funding. We're going to continue to do the right thing when it comes to probation services, but these recommendations are most timely. We strongly support the recommendations of the Justice Reinvestment Initiative, and thank you for this opportunity today.
Thank you, Commissioner. I appreciate it. I appreciate your testimony. Comments or questions for Commissioner Mortensen? All right. Thank you, sir. All right, Mr. Grancy, Travis, you have 3 minutes.
Thank you, Grace. Good afternoon. My name is Travis Granzy, and I am a Deputy County Administrator in Olmsted County. I've been following the efforts in regards to the Justice Reinvestment Initiative and the work that was possible, I believe, with the Council on State Governments for several years, because prior to this role, I was in the role of being the Community Corrections Director for Dodge and Fillmore and Olmsted County. So the courtship, if you will, with JRI has been around for a number of years. And I couldn't be more excited that it actually landed and came to the state of Minnesota. I mean, the work here is really a nonpartisan effort to collect data and provide recommendations to fix our system and to improve our system and what we're able to offer to the citizens of the communities that we all serve. So I'm really happy to see the report that is before all of us, and also excited about the recommendations that are in that report. And I'll get to a few of those points in just a second here, but I also just want to acknowledge also the change in my role. I had a perspective in regards to the justice system in my role as the Community Corrections Director, and I've got another perspective now to offer, I think, as a Deputy County Administrator here in Olmsted County, and that is in regards to the funding, which is one of the fundamental issues here that I think are outlined in this report. 2.5% of the general fund is dedicated to corrections. And of that 2.5%, 22% goes to community corrections. And I think we pride ourselves on a system here in the state of Minnesota that keeps people in the community, because we know that keeping people in the community is the best way to rehabilitate and get them back on the right track. And yet we underfund that to the point that it's putting a squeeze on counties. And that, in essence, puts a squeeze on the system as a whole. We like to work in concert with law enforcement and the courts and attorneys and jails and prisons. And we pride ourselves, again, on that low incarceration rate. And we can't do our best work in the community with the funding that's currently allocated. And that goes across all 3 delivery systems, the Department of Corrections, the county probation offices, and the Community Corrections Act counties. So I think one of our ultimate goals here is to create some consistent statewide practices. I can tell you that being on probation supervision in different counties across the state looks different, and it shouldn't. I should feel like if I were involved in the court system and in receiving probation supervision services in Hennepin County or St. Louis County or Wampanoag County or Fillmore County, that I would receive the same service and I would have the same opportunity to be rehabilitated and to be a productive, contributing citizen. And it's not that way. And funding is one of the solutions to create that. In addition to some of the other recommendations in here in regards to consistent supervision and intervention practices across the state. We know we can do better. Everybody wants to do better. And I say that knowing that we're already doing a really good job. So I would ask that the recommendations in this report, although some, right, I think some create a little bit of controversy even among corrections professionals. I think that in and of itself speaks to the compromise that has occurred as a result of this, and the look from an outside institution like the Council on State Governments. And I think it really points us in a direction that we need to go. And I would ask all of you to consider these recommendations. And I believe that they would point us in a path to make our justice system stronger than it already is. So thank you.
Thanks, Travis. I appreciate it. And thank you for your testimony. Any other comments or questions for Travis? All right. Thank you. We did have one other testify lined up, and he has not logged in yet. So if we have a chance later, we'll go ahead and make some space to make sure he gets to contribute to the conversation. Thanks to everyone who testified today. Always lovely to hear from folks who've been involved. I spent several meetings in legislative offices about 18 months ago with Travis. And so it's nice to see everybody coming full circle and new positions and all the pieces along the way. And Commissioner Mortensen has been involved in the service delivery working group. So thank you, everybody, and appreciate the testimony in addition to the thoughts. A couple of things that I think we just wanted to wrap up today and kind of think through. Everybody got a priority document where I feel like what the co-chairs asked us to do, we're really think about what are the immediate impacts or the policies that would have the most important impacts for this session, knowing that we knew we'd have to carry some stuff over to the next legislative session. So that's the document that you all have received, and we've had a chance to speak with more than half the members of the council in preparation for today's call in order to get a sense of where you're at, what you're thinking, what matches, what needs a little tweaking or revision. And so we wanted to use this document to go through that part of the conversation. And just as a reminder, if for those of you who didn't sit on the working group with us, everything's a work in progress. So nothing is set in stone. That's why there continues to be draft on it. And that's why we have these conversations to make sure that we're not missing something that you all know that we just need more information about. So with that, I don't know, Co-Chair Rosen or Reese, if you have anything to add or if it's okay to just jump in. Good.
I think I'll speak for Reese or Chair Reese.
Perfect.
No, I think we're all good. Please, interested in their comments.
Excellent. Great. Thank you. Well, the first policy option is the single funding formula, right? The primary recommendation is that this year, while we're waiting for a weighted caseload study, we would base that increase in the foundational services of community corrections, whether in a CCA, CPO, or DOC county, or a CPO, DOC county. We would invest making people whole, making the counties whole, but also increasing the FTE efforts for people on felony probation and making sure that as we're concerned about issues of public safety, we're increasing a workforce to respond to those with the appropriate intensity based on risks and needs. The other elements of this, right, are that next year, the base investment would be considered with the weighted caseload, that instead of an FTE based for felony supervision, that second half of the formula would be prioritized on the weighted caseload, so that as we get direct results from Minnesota about how much time it takes to work with someone based on their risks and needs, that we're customizing a capitated rate and then creating a percentage-based formula based on those specific capitated rates. The additional part of this, right, is that we want to make sure that tribes are treated equally as counties, as sovereign governments with the same options and availability, community corrections options as counties have. And then the final piece of this is having a quality assurance unit that's a shared responsibility between the Department of Corrections and the Association of Minnesota Counties, so that we have folks strengthening the best practices and work across the board, regardless of which system people sit in. All right. Anyone from the CSG team want to clean up anything I said? that was all right. All right. Any comments or questions? Any flags people want to throw up about this not being their favorite thing ever in the history of ever? You can throw flags up anytime, just for the record. This is not a forever hold your peace moment. That's the good news. I'm going to go ahead and transition to talk about option number 2. Excuse me. And when we're looking at option number 2, right, we're looking at an implementation committee. So one of the things that's really important is how we sort of strike the right balance and shared responsibilities for all the policy options, be them administrative or statutory, and how they roll out. How does DOC have a regulatory responsibility, but also a service authority? How do the counties and the state sort of balance shared responsibility for making sure policies and practices are with fidelity implemented? And that anything we're asking any service delivery system to do, that everybody's doing, right? So traditionally with Justice Reinvestment, you all pass some work, we do some administrative changes, you have a budget, we have some legislation, and this triggers an implementation process. That means you get additional CSG staff, you get $500,000 to play with, and through that we can make some of the changes with fidelity that we've talked about all along this process. So what policy option number 2 does is it really connects a lot of the administrative changes to a Justice Reinvestment Implementation Committee, which are statewide service standards and definitions, a statewide risk screener and risk assessment tool, or a way to map all the risk assessment tools to the same 5-level matrix to make sure that there's consistent scores regardless of who's being supervised by what agency and what county. We're looking at formalized case planning and making sure there's places that we're using the results of the risk assessment tools to have case planning around supervision, developing a statewide incentives and sanctions grid, developing data outcomes and metrics. And then one of the revisions that came out of the conversation was making sure that the implementation committee actually explores essentially a mirror of the county system, which is what would it look like to have a state corrections committee, a statewide community corrections committee, where you have an advisory group to the DOC, and we sort of codified that shared responsibility and obligation to community corrections in Minnesota. Senator Rosen.
Yes, thank you, Grace. This doesn't have to be put in statute, though. You could do this. We can just do this, correct?
We were hoping to have the committee connected to the budget so that we could revisit a formalized structure maybe later, but most of the other changes are administrative, yes. Thoughts or comments about this one? I don't know. I know Kelly, CJ, and I, and Madeline talked a lot about some of these pieces, but yeah, Representative Moran.
So just for transparency's sake, I'm just looking at some of this work that we're doing in the agreement that's been put forth, which I think are really good, but I'm struggling with the authors of the bill. I think we have to get a buy-in with the majority in the House. And right now, I'm not seeing that based on who's carrying the bills in the House. And so I think we need to have a bigger dialogue around we move this bill forward, and who's at the table and having these conversations with all the work that has been put in. It needs to be a real, authentic type of movement that I'm not seeing right now, or maybe I haven't heard. It's been a part of this decision-making process here. You know, I'm not seeing that connection or hearing that connection.
Grace?
I'm on mute. Sorry. Thank you, Rep. Moran and Senator Rosen. You wanted to respond?
Yes, I do want to respond to that. Representative Moran, that bill of Senator Pratt's was put in a long time ago. I mean, that was before any of the thought pattern of what appropriation is needed to go forward with these recommendations. So that would be the most simplified way of moving something like this along, unless you want to create a bill and send it to the revisor's office that's backed up. And that could be a problem. But no, there was no intent to sideswipe anybody. This was something that was created right at the very beginning. And I'm just tagging along. I'm going to amend it.
Yeah, I understand that, but I still see there needs to be some intentional work here with the majority in the House. And that's the disconnect that I'm feeling right now, with that disconnect with the majority in the House. And I think, you know, we've done well about not trying to be as bipartisan here and just looking at what we need to do to create a system that is really all the things that I just heard come from Travis, in his presentation, and Kurt, and also the commission. I mean, there's a need that has to happen here. And I think that it needs to be made through a continued process of a bipartisan lens. And with two Republican authors, to me, that makes it really difficult.
Grace, Representative Moran, there was no ill intent on this. This was something
No,
that
I'm not saying it is. I'm just saying what I'm
half an
feeling
hour
here.
ago, this was discussed on how to move this forward. Because that bill was before Judiciary this week, that was the intent. But if there's something that you would like to create on the House side and get that moving, I understand that. We can certainly, look at it through that lens also. But this was my attempt to get something going.
And Representative Moran, I think there's still room. What we did was we had a conscious decision in about 30 minutes ago to think about it as a vehicle and to think about how we could sort of use the existing framework. But I think there's plenty of room for additional sponsors, additional language. And I'm going to hold true to our drafty process of this council and just make sure that what I hear when you say that is interest and participation, and I would love to take you up on that. And so whether that's a meeting with Representative Johnson or one that we, you know what I mean? Because I've actually, there's lots of room. I haven't actually spoken with Representative Johnson, and so some of it was trying to be efficient with what legislation was already drafted, and there's ways to be smarter about it. So,
Yeah. All right.
Yeah, CJ.
I just want to that end, talk a little bit about, in a great deal of detail. We obviously didn't have these recommendations, but we've been having conversations around this, and particularly around the funding part of this, with a variety of folks in the House, whether it's Chair Mariani or Representative Johnson or whomever. And so if you're interested in that from where have we been and what conversations have we had previously, Representative Moran, I'd be happy to sit down with you to talk about that, and perhaps we can coordinate in that way from an author perspective as well, if you're interested in that.
Yes, that's a great idea. I would love to hear your perspective. Also, I will also take some time to speak to Chair Mariani to also hear that from his viewpoint again, and not trying to make this partisan but I just think, usually the majority in the House is leading, right? And just for the practicality of the process, I have this moved through legislation. You know, I think that is something that we have to take into consideration.
I do want to say too, Grace, that I just apprised Senator Marty of these thoughts. So he's been abreast of this the last 45 minutes. Right, Senator Marty? So this is not, there's a vehicle in place, and that's exactly the thought pattern here, to get it moving.
We want to get it moving, that's for sure.
Well, and we definitely jumped on an opportunity. So I appreciate that, Senator Rosen, Senator Marty, Representative Moran, and Representative Novotny. Obviously, you were asked to sit on this council for a key reason. Justice Reinvestment is bipartisan, and there's ways to move this forward for sure. Commissioner Schnell.
Thank you, Grace. I think, just to Representative Moran's point, I think, one of the things in some of the conversations we've had with some members in the House is that there is this sense of where is the accountability to the community, and where's the accountability to the outcomes, and I think that's here, and I think it's perhaps a bit of a reflection of some of the work we need to do is to make sure that we're doing this in a responsive sort of way. The report was quite comprehensive and really broad by way of policy, as well as the funding. And I think, those have been some of the concerns we've heard. And I think, to Representative Moran's point, I think bringing folks along and making sure that there is that sense of awareness of what goes along with the ask. And there was no question about need. It was really more about, what is it that this investment does by way of outcomes. And that was some of the things that we had heard in the conversations I've had. But I do think there are some places we can help bring folks along.
Thanks, Commissioner Schnell. Other comments, thoughts? Yeah, Kelly.
I just want to say it's very exciting to hear the interest in the funding. I think that is step one, and that's really important. But I can't underscore the importance of also making sure this implementation group is created and put in place. Because if we don't also work on making supervision more uniform across the state and improving our practices, then the funding's not going to do a lot other than put a few more bodies out in the field. So I think both pieces are equally important, and I really hope that we are able to move forward on both fronts.
Thank you, Kelly. All right. Any other thoughts or questions? Okay. Trying to navigate. I'm trying to do too much multitasking of making sure people are where they're supposed to be. This is very exciting on my end. After we talk about sort of what the Justice Reinvestment Committee could do, the next one is to develop a revocation or halfway back caseload or units. You can use whichever of those words that you want. It's our understanding that the DOC already has some of the authority to do the pieces that we highlighted, so likely we don't need to codify this, but the idea of creating a revocation unit, which is a way of really wrapping case management around technical violations in a supportive way so that folks don't have to be reincarcerated, especially if they're nonviolent, right? Folks committing nonviolent offenses where they wouldn't necessarily get programming by going back into incarceration or going for any short-term time. David, I'm looking at you to put a finer point on my mumbled words.
No problem. Yeah, I had the opportunity to have a conversation with several folks over the last couple of days, including Judge Frisch. And one of the things that I realized is that we did not make it clear enough that what we're talking about are nonviolent offenders, that we're clearly talking about people who are not a public safety risk. And so if that's the case, why are there are these issues? It goes back to what I've talked about before. there are a significant number of people on supervision with significant mental health and substance use needs, and they have difficulty meeting the requirements of regular probation sometimes. They end up failing on technical violations, not out of ill will of anybody's part, but because the belief is this person may be in trouble, they may hurt themselves, they need more than we can provide here in terms of what we have. And so what we want to do is to have something that provides a much more intensive kind of intervention, not a punitive one, but an intensive one in terms of sort of case management, support, programming, et cetera, so that those folks can then return to their, quote, regular caseloads and do well, as opposed to, for reasons that are not related to public safety, the person ends up in worse condition by losing their job, if they have to go back into jail or prison, by further family disruption, et cetera. And so we need to clean it up just a little bit so that we're clearer, the message is clearer about what we're trying to do. I can tell you that where I live, we have been doing this now for a number of years, and it is a very effective process for really helping a number of folks that just doing the traditional you do this or you go back process really does not work in a very effective way. And so we'll clean that up a little bit, and we'll get it more specific. Want to respond to the concerns of Judge Frisch. I want to respond to the concerns that we're not suggesting something about lack of accountability. We're really talking about people who need a little extra, for lack of a better way of putting it, oomph in terms of being able to succeed, and that there are ways to do that. Given the changes in probation populations over the last decade, when we look at the issues of mental health and substance use, we need to be rethinking some of the approach. And so that's where this is coming from, and we'll work on that over the weekend and get that a bit cleaned up.
Thanks, David. Any comments or questions about this policy option before I keep moving? All right, great. So there is one other statutory change that would be important, which is consolidating all the supervision powers into one statute. Sometimes we just call this cleanup language, but it's definitely something where we'd like all the things to live in one place so that everyone's being governed by the same set of expectations, and that we have a really clean, simple statutory framework for the work going forward. There are other policy options that can really be accomplished administratively that we've listed in this document, with a little bit of extra tweaking after conversations with folks on the council, to just basically say that if we work on how you transfer authority, supervision authority amongst districts, that we're really going to the district where the most serious offense lives, and not just picking our favorite corrections officer. It's not a choose your own adventure. It's really making sure that the county with the serious offense has precedence and the ability to be responsible for the person on supervision. There are different ways, some of the tactics that we talked about as far as reducing people on active supervision and limiting the supervision of folks on nonviolent or non-person misdemeanor offenses are all things that can actually be done administratively. And I think, David, you said it best with the county commissioners on the other day, which is when we over supervise people that pose no risk, we're actually magically creating risk. And so the focus of this is to make sure that we have the right level of intensity with the right person to address the risks and needs that make them successful, to some of the statements you heard from Mr. Grancy and the commissioner earlier. Automatic enrollment of victims into notification is administrative, and then expanding the use of the regional certified community behavioral health clinics is also things that can be accomplished administratively. Does anybody have any comments or questions on that section of policy options, or any flags after we cleaned up a couple things based on your recommendations? Yeah, Kelly.
Getting into the weeds kind of question here, but when we think about people who have cases going in more than one county, the thing that strikes me is that if you get too prescriptive about it being the county with the most serious offense, that may not be where the person lives or where the support network is. And so, like, do they need to be living in the county that's supervising them or not? So I just want to, provide the they could, someone can commit a crime where they don't live. So I just want to provide the flexibility for that person to be in the place that's the best place for them to be as well.
That's a really good point, Kelly. And I think the idea too is not to take away discretion. Carl, you were going to jump in. I'm sorry. Please go ahead.
Basically the same point, Grace. I think a big part of this is coming up with a consistent process to sort through those kinds of decision factors and maybe list the factors and their relative weight or whatever, but it's as much about a process that's used over and over again as it is about coming up with the single most determinative factor.
And I think, at least from my perspective, Kelly, we really do have to work those details out. And is it the most serious? And where's the degree of discretion? And different judges have different views about that. And there's all of those things. But and there's even been some talk about, well, we should figure that out first, and then we go down this road. If that happens, it'll never happen. I think we need to say this is where we need to end up. And then part of that implementation committee and the work of the 3 delivery systems together is how we then iron out and figure out what's the best way to do this, what's the best process. At least that's my perspective about that.
Thanks, David. Jason?
Yeah, and forgive me if this is getting deeper into the weeds, but there is a statewide policy concerning this that all 3 delivery systems have agreed to. Is it perfect? No. There's some shortcomings, not the least of which is that policy and that policy states that to transfer supervision from one jurisdiction to the next, they need to be at least medium risk. Medium risk as determined by a validated risk instrument, but what the sending agency decides what medium risk is. So now we've got an area for, so some of these other policy things that we've talked about, identifying and determining statewide what risk levels are and having an agreed upon risk level matrix, these sorts of things will attend to that. So I guess I say all that to say, I don't think there's as much work here to do as what maybe is hinted at. I think we're farther along in this one than maybe is what's suggested on paper, but a lot of those nuances I think would be attended to with other things that we're going to do here anyways.
Thanks, Jason. Jump in, David. You're good.
No, I mean, Jason's point is good. And I've said this before to I think, several different committees, is that Minnesota has a lot of cool things going on, that a lot of it happens unilaterally, or it happens and it gets to a certain point and it stops. And certainly in terms of my specific work on this team, I've said several times that a number of my recommendations are basically to try to help push what's gotten started, but in some cases has either gotten stalled or has gotten a little bit off rails. And so the nice thing is, I think in several of the recommendations, Minnesota's already halfway there. The issue now is how do we get it over the goalpost, and how do we make sure that it's done consistently throughout the different systems?
Thanks, David. I want to just acknowledge, we're going to let Senator Rosen go where she needs to be in Montana here on time. So I just wanted to leave a little space for that and make sure Ali had a chance to testify before Senator Rosen had to sign off. So with everyone's blessing, we're going to take a little pause. Ali, if you're ready and available, we'd love to hear from you. You have 3 minutes, and we can kind of go from there if that works for everybody. Ali,
is it right now?
Right now, you're on.
So, one thing I want to consider when it comes to reinvestment, is not just time. I mean, not just funding. I also look at the amount of time and attention gets spent on certain things. And right now, like when it comes to just investing, as far as justice goes, I think it's important to not just assume or come with a team of colleagues and just try and just make the best move. I think it's important that we really get a certain amount of feedback from a pretty diverse amount of groups, so that we know exactly what we need, so we can be a lot more equitable just throughout a lot of the things that we're doing. As I've seen a lot of these conversations go in the past, I feel like a lot of insight gets dropped, but as far as all these ideas coming together, I feel like a lot of important things get left out. So when I try to look at reinvesting, I try to not just look at, one thing. There's a lot of things that could be invested better. And I think there needs to be attention shined, like they've already talked about mental health and a lot of other things, but I believe that it's important we actually start asking the people what they need and where they think some of these things should go. We are only a small group of people and we can only speak for so many people.
Thank you, Ali. I appreciate your testimony. I'm glad you're here with us today. Did anyone have any comments or questions for Ali? And actually, it's an excellent segue into talking about the final section 6, which is what we're doing on the Governor's Council on Justice Reinvestment. What we're doing with Justice Reinvestment is only a portion of the efforts that are going that impact the other folks on the criminal justice system or folks who are on supervision. And so one of the things Madeline and other folks on the team did were look at what other efforts are underway this legislative session that have a chance to intersect with the work of improving community corrections and the response to individuals across the state so people can be successful. And so you'll see on the list, and Madeline, I don't know if you or Carl were going to run through this list, but just a couple of things we tried to organize were efforts where lifting up the criminal justice folks and keeping the priority of folks on supervision and the success of folks on supervision as it relates to behavioral health, as it relates to other efforts is critical. And so we just wanted to make sure that people didn't think we were ignoring some of the big issues that you've said, but we're jumping on the wagon of other people who are and lifting up and supporting the efforts, other sometimes really big efforts to make things a little bit better in other systems. So Madeline, did you want to run through this list and then I'll stop.
Thanks, Grace. I think that was actually David that's gonna take that list.
It's all you, David. Sorry.
That's okay. Just a moment. I need to. So in this particular option, we're talking, these are the behavioral health related options, correct? Right? And so we know there's a lot of things that are being looked at across the state. And once again, what's happened is that everybody's not necessarily working together on that. And one of the things that is particularly troubling, I've said this in several meetings, is that there's a number of important things that are happening that corrections, and by corrections, I mean the 3 delivery systems, are not at the table about. And they're really good things that are happening, but people forget, the larger world forgets that so many of the clients they're serving are also being served through one of the 3 delivery systems because they happen to be on supervision. And that includes the issue of looking at mental health services, looking at substance use services, the difficulties in terms of getting to those. So there's a number of recommendations. One, in terms of the issue of having the workforce look like the people that are served, there are a number of barriers in place for folks getting professional licenses, and that's being looked at, but it needs to be looked at carefully. And the barriers need to be looking at the issue of, are we unnecessarily keeping people out of professions when the reason that they may have been in trouble has nothing at all to do with them being able to be a good service provider now. The second issue there relates to the issue of costs involved in some of the things that are required that are, frankly, a bit more, they cost more and they're a little more intensive than what I've seen in most states. And so can we revisit that? Or if you don't want to change that, is there a way to provide supports for folks, particularly folks of color who graduate from social work school and other kinds of graduate schools, to be able to then have the resources to be able to get to the point of being licensed and to really help develop the workforce? Medicaid, right now you suspend it for a year, but then it gets terminated after that. Why? There's really no reason to do that. So we're recommending just suspend it throughout, whether it's for 1 year or 4 years. Among other things, that allows people to do better inreach. We heard from the county folks earlier about the time it takes to get going. Even with the suspension right now, in many cases, people then have to get to the Medicaid office, which creates some difficulties in terms of time, problems in terms of front-loading supervision, problems in terms of success rates. So if we suspend and if we develop an in-reach process, which some places in Minnesota do have, remember, I'm always thinking about everywhere in the state, and then we can really improve the speed that people can access the services that they need. We can really make sure we're front loading the appropriate kinds of programming for those individuals who are returning to the community. Direct access, much like Senator Marty, I certainly support the concept writ large. And we're arguing that there need to be some tweaks in terms of people who are on community supervision, specifically those people who have moderate and high behavioral health needs. We unintentionally, what's happened, and I think the Department of Health has really talked about this. They really didn't talk with the corrections folks, the 3 delivery systems, about this in any consistent fashion. And so what's happening is, what's potentially going to happen is that unintentionally, the highest need individuals will get set up to fail. And we already see that in your system. Lots of people keep coming back for substance use issues. Lots of people are going into multiple treatment programs again and again. A number of people are going into the same program that's clearly not the level of service they need again and again. And with some of the potential changes, it really cuts out the people who should be the primary case managers for these folks, which are the agents, who have that responsibility for helping those individuals succeed and have the responsibility for public safety as well. And so really we would argue strongly there needs to be some tweaking of that. Direct access is a great thing, but for those folks with really significant behavioral health need on supervision, it's not fair, frankly, to them to set them up to fail by not having the other folks that are surrounding them provide the appropriate supports and direction, if you will, and input in order to get them into the right programming. And then lastly, I've actually already said this, but the last component of that really is the 3 delivery systems need to be at the table. For the people that are meeting about housing, the 3 delivery systems need to be there. For the people that are meeting about mental health and substance use treatment, the 3 delivery systems need to be there. For people that are talking about child care, child welfare, supports for people, the 3 delivery systems need to be there. All we need to do is look at who you have. All we need to do is look at the number of people, who they are, what their struggles are, all of these other initiatives in Minnesota. We need to increase the ability for the 3 delivery systems to have access and have a voice and a role in that, because so many of the things that those good folks are trying to do are the very things that your folks need, yet inadvertently or otherwise, too often, those folks' voices are not part of the conversation, and they really need to be. And with that, Grace, I'll turn it back to you.
Thank you, David. And thanks, everyone. So one of the approaches, and I'm going to interpret for Kevin or the microphone failure for today, which I've had 17 million times, but the piece I heard from Co-Chair Reese and Co-Chair Rosen was that rather than take a formal vote or anything today, what we just wanted to give folks a chance was, when we look at the modified list, when you think about the conversations that we've had in January and February, if there's anything on this list that gives people pause, or that keeping it on the list would interfere with your ability to support this as the priority for this legislative session, and then recognizing that we have a full report that we can continue to work from for next legislative session and continue to build support around. So yes, Senator Marty.
Thank you. I'm not critical of what's in the report. I'm worried about losing the things we're trying to get done. And so no vote, I understand that. But a lot of these things, like the one about making sure that we make it easier for, where was this? I think it was the first one under number 6, making it easier for people to get professional licenses. Those things, they're not always instant and easy to do things, but I think that this group, I hope that what comes out of this is a real push to make that happen. And then again, I want to second the one because I raised it when I first saw it, the unintended correct consequences of the direct access model, option C, because like David, I'm a fan of direct access, but I think we're really missing it if we're not recognizing that many of the people who need direct access, and he mentions they should be able to get it directly without the Rule 25 assessment. Managed care organizations, often direct access relates to the fact that they block people from getting the care. They're not managing care, they're managing claims payments. So I really like direct access, but I also think I think that's the thing that has to be a priority this year, because we're at the end of a 2-year phase, which I wasn't aware of, but as of this July, that entire thing, the direct access will be the fact statewide, and counties are dismantling some of the system they have in place to helping assess. And I think that's a step backwards when we're trying to improve the supervision system. So I guess that's the one specific one that I'd say. I'm worried that a lot of these things we don't have time this year. I actually think I encourage Representative Moran and so on to drop in a separate bill with all the recommendations she feels appropriate and the funding that was called for, because I'm not sure the other bill, we can pair up two bills that aren't matched, that aren't companion bills. That's the only reason Representative Johnson's bill is in there, I'm assuming. And he's not on the task force. I encourage Representative Moran perhaps to do that, because I want to see these steps move forward. And that one specific one on supervision, direct access, I think if we don't do that now, it's going to be 10 times as hard to fix it later. And when we get to the funding thing, I want to talk more about some of that. But I think this task force, this governor's commission, is tremendous. I've learned a ton from it. I think there are so many thoughtful things being said. I'm just afraid we lose it all. I've seen it happen too many times. We have a task force and, well, we'll get to the policy someday. And the money, we don't have money for it. And actually, this is the only year we got the money for it in the past number of years. And so I don't think that this is going to do anything less than make some significant improvements in our supervision system, significant improvements in the system. But I think at this time, with all the debate about public safety, I think this is a chance we could make game-changing changes in terms of crime. And I think we're punting on that now. And a lot of that's funding, a lot of it's these policy changes. And so that's not so much the specifics of what's in here, but it's the fear we put this all together. You put this all together. Wonderful things, and that was a good idea. We'll put the report on the shelf and maybe a few things happen. And I'll go into the funding stuff later, but that's enough for here.
Thank you, Senator Marty. I hear you saying, let's not miss our chance, right? Let's not let something move to a dusty shelf when it has some life and breath right now. Thank you. Representative Moran.
So, yes, I agree with Senator Marty. If you check the chats, I am in agreement. I think what I've heard here thus far is that a lot of support from the recommendation that has gone forward. I struggle with what I heard from Senator Rosen, who said that this was put in place a while back, which means that it does not align or in agreement with what we are agreeing on right now that needs to happen. And if we are in agreement that we need to do what was put forward, then what the bills that I see before us does not align with that vision. That's what is my concern. And so, if we want to have an honest, saying that we have not sat through this and waste our time, having these conversations bring forth evidence-based practices, what we believe is going to reduce recidivism and create better outcomes for those who are on probation as they enter the community, then we have to have a bill that is a reflection of what we think needs to be for. And I say that without having even read this bill, but I just believe it couldn't be what we put forward because it was just done so, so far in advance of where we are today. And so that's the conversation that I can have offline with individuals as we move forward.
I welcome that conversation, Representative Moran, because you're correct. When you open those bills, it does not reflect this process. And it has only been discussed as a vehicle. And I feel like that's another strategic conversation that needs to be had. So thank you very much. Yeah, Jason.
I'll echo some obvious things that I'm in support of 98.5% of what's in here. And I wish there was another 12% of things that aren't in here. But I am encouraged to see that for the first time in my career, that there's some substantial substantive things that are being proposed here. I'm not a legislator. I couldn't imagine if I were. Every time I spoke, I'd think it was a filibuster, and I just get to talk until I lose my voice. It'd be like that scene with but anyways, I'm not, but I have social capital. I know people, and I have representatives, and I got this, and I'm the representative, and you all do too, right? There are lawmakers on this, of course, but the rest of you are here for a reason, because you have social capital, you have capital, and you have influence. And so who do we need to talk? Which offline conversations do you need to have? Who else needs to be brought into the fold here and reached out to formally and informally to be made aware of what's on the line here and what we have the potential to do to move the needle on public safety, to move the needle on helping the clients we're trying to help in the communities we serve. So we all still have some work to do. God so loved the world that he did not send a committee. We got to take some ownership, right? And not have like a diffusion of responsibility thing and go, well, let's see what this council can do and let's see what they can do. Or what can I do? What can you do? Okay, there's my rah-rah speech.
Thanks, Representative Filibuster. Appreciate it, Jason. Other thoughts, comments, musings, things people want to flag? Yeah, Senator Marty.
Yeah, are we going to talk about funding at a separate point, or is this the time to talk about funding?
Now's a great time. Thank you, Senator.
Good. Okay, I don't mean to unload too much, but what I said earlier about how I'm afraid that with all the debate, it's going to be one of the hottest issues in the election year, and I'm afraid what we're going to be doing is what they call tough on crime. I call dumb tough on crime. We're going to do more policing, more prisons, more of this, longer sentences. Boy, that's going to do good. And the nice thing is it doesn't cost anything now. If we increase a 5-year sentence to a 7-year sentence, it doesn't cost the state a penny more for 5 years or 6 years if it takes a year for somebody to get their sentence, because they're already serving 5 years under the current law. We add 2 more. It doesn't add any cost for 5 years. Then it adds boatloads of cost. We made these decisions in the past, and I don't call that tough on crime. I call that dumb tough on crime. And I'd like to see us talk about the smart tough on crime. And when everybody's talking bipartisan talk about how we got to make our communities safer, and we're scared about people, and we're scared about all this. And here's CSG comes in with a whole bunch of things. Here's what we can do to improve supervision. And I used to chair the Judiciary Committee many years ago, and haven't worked on this stuff in a long time. So this is really re-educational for me, because I haven't heard a lot of this in years. But I'm hearing wonderful stuff about this and how the first 90 days with somebody under supervision, that's the chance you have to connect with them in the first 180 days. You got to get them all the help they need. And supervision is, well, it looks like it was $3 to $13 a day per person in it. I know what prison costs are and everything else are, and the cost to victims and everything else. And we ought to do something about that. But here we're talking about how several of the folks, Roseville County Commissioner and Jason and others have all pointed out, a lot of places don't have mental health, don't have CD treatment for substance use treatment for people who need it. So no matter how good the supervision is, if they don't have the services, if they don't have the housing, if they don't have other stuff, they ain't going to succeed. And I was trying before the last meeting to try and get somebody to give me a ballpark of how much it would cost if we did. I was glad to hear the Ramsey County people It's my county. I'm glad to hear that, though I'm not, they said they're giving mental health treatment to anybody who's under supervision who needs it. Substance use stuff, well, that's harder. And what they're doing for mental health is, well, you can qualify for this, and if you don't get that, maybe you'll qualify for this. And I don't want to be on a soapbox for long, but I do want to say that we are not going to succeed if we don't do this. When we heard from Roseau County about that, and then we started talking about how a lot of the rural counties don't have the needs, and CJ says, we got the problems in Hennepin County too. We got the problems statewide. So I tried to get a number. Was it 50 million or 500? Just a ballpark on how much it would be if we were going to take these 85,000 people, and maybe not nearly that many should be under supervision. And not every one of those folks has mental health or CD needs. But how much would it cost to address and make sure every one of them got the treatment right away, not 3 years from now, but they got the treatment? I think we'd have a game-changing thing on crime. And the housing. Well, that's way off in the thing, but I keep thinking there are these services. I heard from one of them, Better Futures Minnesota, I think it was, who deals with felon offenders, and they support the supervision system by coaching people, helping them into housing and jobs and so on. I know there are a number of nonprofits that do that, and they're all struggling. Well, we can get a grant here, and then we can cover a few more people. I keep thinking, not for the cost savings, though that's a huge benefit, but just for the public safety and for the lives we save, the people who can turn their lives around and raise their kids instead of being in prison. And I just think we're making some significant improvements, but this is one chance we have to make a fundamental change in our crime system, where we're not encouraging people to go back into crime, but we're helping them out of crime. And the supervision system is so central to this. So I was glad to serve on this task force, but I also think when we're talking about investing in this, we have to invest in the housing, and we have to invest in those things. And in the sad thing, I kind of raised this a week ago or so, and I didn't got a lot of, well, that's not quite related to what we're doing, and I know that. But my feeling about missed opportunity is I've been doing this a long time, and I've never seen a situation where we had $7 billion. They haven't had $3 billion in the bank before. And by next year, it will all be gone, either by tax cuts or other allocations of the money. And then if we say, but we really ought to, this is a high priority, because I don't know of any Minnesotans who don't think we should make our communities safer and that this really would work. But if we're going to put that money in, if we're not going to put the money, set it aside now and say, we're really committed to making our streets safer and making lives better for people and everything else. We don't do it this year. Next year, we could come in and say, well, that's a good idea, but we don't have any money. And I want to say that because I'm really want to say how much I appreciate the great recommendations in here and hope we do them. But even the 25 and 38 million you propose, which is apparently not what we're going to get, that's a little bit better than inflation, maybe. And the state budget doesn't even account for inflation. We cook the books in Minnesota. The CSG people may not know that. We count all the higher revenue from inflation, but we don't count the expenditures. So if we want to put more, if we want to keep up with inflation, we have to appropriate more money. That's the way it works in our system. And so if this is maybe inflation, I just worry that we're going to be expecting the system to make all these positive changes and not even do better than inflation. So that's a long rant about it, but I feel very strongly we're missing an opportunity. And I wanted to say it somehow, and I'm not sure how to make it happen, but these are people's lives involved in both the people who are offenders and we don't want them to be, and the people who are victims of that. And I wish we have a way to do that. And I'm not sure how. I don't know if CSG can step in and help with this for whatever, but this is the year we should be doing those things. Enough said. I'm sorry, I went on.
Please don't apologize, Senator Marty. I think what I hear when you speak is I hear opportunity, I hear an investment in the process, I hear an investment in the recommendations, and you have a lot of support on our team for this whole process. I know I will speak on behalf of at least the Justice Center team, and that we have spent many hours with people who feel very similar to the sentiments that you're representing. And I know that the timing is right. I think there's some work to do even after this meeting to just figure out what the best vehicle is, how to involve in a bipartisan interbranch way everyone that's been involved in the process and get it to a place where we can get additional legislative buy-in and support. So please don't hear anyone discrediting what you're saying, and just let you, like, this is still part of the process, right? The council's where we would prioritize these issues. The legislative session is where we negotiate to find the sweet spot of what we can actually do right now and what needs to happen next year. And I mean, but anyone on my team would say that I am anything if not a very optimistic, don't tell me it's done till it's really done person. So we got some time. Thank you, Senator. Dr. Williams.
I'll try to be brief, but I think Jason may have captured the essence of what I wanted to say relative to Senator Marty's last comment about funding, and something that I do think is missing from the report that's been kind of foundational to our conversation thus far, and that's a campaign of community education. The reality, as Jason articulates here, is that this is far bigger than change. Transformation addresses the framework. And the reality is, I think a lot of people probably watched the Kim Potter sentencing today and heard Judge Chu articulate in a very basic way the 4 principles that undergird sentencing in Minnesota and the country as a whole. And when you think about applying a rubric like that in that way, in that particular case, I'm sure a lot of people are going to be torn on it politically. I'm not speaking on it from that standpoint now, but simply to say that it would be in our interest to allow the community to think through the difference between change and transformation with an education program that doesn't assume that people are simply on board and that everybody means the same thing when they talk about public safety. I think that's Senator Marty's point with regard to other moments like this in Minnesota, 1989, 1975, 1967, 1964, and the election of Stenvig in Minneapolis. All were moments where you had an opportunity to reimagine public safety, and the response that you got were more police, more jails, longer sentences, and by extension, a less safe Minnesota for everyone. So my only comment is that I would hope that we could think about, and I think this is part of the transformation that Jason is talking about, some type of public education program that goes along with this, that isn't driven by slogans, that isn't driven by interest groups, but that is driven by this committee, perhaps a bipartisan effort on the part of legislators to say, for the future of Minnesota, it's best for us to begin the process of changing the language and increasing dialogue on this with some real education around what is it that we were talking about from the 19th and 20th, early 20th century models that Judge Chu was invoking today, and what is it we'd like to get to with the 21st century model that ultimately this group was tasked with thinking for the state, talking about for the state.
Thank you, Dr. Williams. I feel like David and I had a version of this conversation today, which is there's certain efforts that have pushed corrections and community corrections in particular to here. And some of the things in our policies that might not line directly up with that are actually a 21st century idea, and how you start to move a little bit beyond that. Because we're not just trying to churn through things. And as much as I know this report didn't go as far as a lot of people wanted it to, it actually goes a lot further than a couple of places that people may have originally thought, because it's more of a forward thinking place. And that's at the benefit of people who are on the working group, the place that Minnesota corrections officers and leaders around the state are a part of. David has the opportunity, Carl has the opportunity, Michelle, Madeline, Jess, Matt, all have opportunities to build something based on where a state's at. And this is a reflection of a really moving 87 counties and 11 Indian nations a little bit forward at the same pace in ways that are, they're a little kind of cool. There's some cool stuff in there that's not just a variation of a traditional story that we've heard. So thank you, Dr. Williams. Other comments, thoughts? Kevin, I love you weighing in the chat. It's great. Thank you very much. Yeah, CJ.
I was just going to lift up a little bit what Kevin is saying in the chat too, what Charisse is saying, that the idea that we're sitting around this table, and I think it combines well with what Jason said earlier in his rah-rah filibuster, which is, we don't all agree on what's in here, which I guess in my mind makes it what feels right. I think if we all agreed on it, we would have people in the room that weren't being honest. We'd have people in the room who were being silent, who didn't maybe want to be, but felt like they had to be. I think the fact that we have reached a place where we're all comfortable enough with what we see, to me, speaks to we have actually had voices have impact on what we're choosing to bring forward. And in some cases, voices that, to Ali's point earlier, voices that we don't often include or don't often listen to. And I think the value of having not just systems people and not just legislators sit around and have these conversations, but being conscious of the ways that we need to include those who are directly impacted by the decisions we make, I think is part of how we get to better decisions. So I'm with Jason. I'm pleased with most of what I see before me. And I am very much looking forward to supporting how we move that forward. And I appreciate, Senator Marty, your comments related to direct access and the unintended consequences that may have on some of the population that we serve. And I agree that we need to do something to address. And also, I will keep coming back to, we have to start with properly funding the 3 delivery systems that exist in the state of Minnesota, because if we don't, it doesn't matter what the rest of those services might look like. Because if we don't have enough supervision resources in place to help get people to those resources and make those connections, that is a huge part of what our probation agents do, is connect people to those resources so that they can be successful. And it's part of, frankly, why we know there aren't enough, because our probation agents tell us that as often as our clients do, because they care about the success of their clients and they see the ways in which the lack of resources impact the ability of their clients to succeed. And so I guess that's my rah-rah filibuster for today, because Jason and I, we have to take turns with our rah-rah filibusters, but I'm impressed with the space that we have gotten to in this room, virtually or otherwise, and the rooms that have been in conversation outside of here to help us get to this space. So for me, I'm looking forward to what comes next and how I can best support the work moving forward. Thank you.
Thanks, CJ. I do like the idea that after this work, we'll have to have instead of friendly amendments, like a friendly filibuster. I'm not sure I've ever heard it's like oxymoronic, the friendly filibuster. Anyways, you all know what I mean. There are council members who I haven't heard from today. I don't know if it's worth, if people are co-signing with not necessarily contributing directly to the conversation, but I want to make sure before I yield back to co-chair Reese that I give everyone a chance. Thank you. Representative Novotny, were you going to weigh in?
Thank you. Yes, it's been an opportunity to listen and learn, so I've been trying to stay back, but just trying to clarify some of the language. We're still looking at just a 50% reimbursement for supervision of juveniles and misdemeanors. Am I reading that right?
That's only for the first year, Representative. So this first year, making the CPO counties whole at the 50%, and then the additional FTE pushing towards the formula is based on an FTE supervision investment. But after that, we'll have the capitated study that will include the juveniles and include all the caseloads. So going forward, that 50% dissolves, and it will be based on who people are supervising and making sure that you have the resources based on the needs and risks of the people on your supervision caseload, whether they're juveniles or misdemeanors, right? It will get figured in the weighted caseload study.
All right, thank you.
Yeah, you bet. Yeah, Commissioner.
I would just say that I'm grateful to be here. I think back of some of the conversations that we've had along the way, and I know that this has been literally 40 years, 30 plus years. And I think that was brought up a little bit last time by Mike McMillan when he testified last week. Just those opportunities, and this is one of them, I think, as Senator Marty talked about with the dollars. If we are serious about trying to do something that really can help people make a difference, can help people be more successful, who find themselves in the system, and ultimately reduce the number of people who get impacted by crime and wrongdoing, then this is the investment, and this is the time to make that investment. And from an administration standpoint, I'm mindful of my role as the one executive branch representative here, and so, but I think it is important that it to be clear that from an executive branch standpoint that we are supportive of this, and we think it is, and this reflects really good policy for the good of Minnesota, outside of the partisan life that that oftentimes exists. So I just want to speak in support of the comments that have been made by my colleagues from a corrections standpoint, and commissioners, legislators, that this is the time, and we stand in behind. I really feel strongly that you can't advance this just the dollars without some good policy language, and I think that's critical that happen as well. And that ultimately we find a way to connect the dots. I think as Senator Martin system work that is happening at the same time we're having these conversations. So I'm grateful for all of you and for the willingness to kind of go on this journey. And I'm excited to see what can happen, and certainly we will do anything we can to help support advancing this forward.
Thank you, Commissioner. Last call, last comments. Anything from the CSG team that folks want to weigh in? Something I missed, something to add? All right, I'm gonna, Kevin's gonna smile while I read his comments to everyone. But on behalf of Co-Chair Reese, hey everyone, honored to serve on this council with you, amazing leaders and citizens of Minnesota. My commitment to justice and community safety will land me back to this conversation as many times as needed until we get there. Blessing to you all. None of us are free until all of us are free. Thank you, Co-Chair Reese. Thanks everyone on the council, and you'll be hearing from Justice Center team members in the next few days. So thank you very, very much, everyone. Enjoy your weekends.